Hello, good day, Sitaram, and welcome to another program in the series Addiction and Recovery. I'm your host, Ram Naresh Dwarika, as usual on a Thursday morning, welcoming you, all our brothers and sisters in Trinidad and Tobago, up the Caribbean, and worldwide, to this another program in the series Addiction and Recovery. And just to let you know, this program is being recorded and it will be posted on YouTube and Facebook soon after its completion this morning. It will also be replayed on radio and TV Jagriti at 9 p.m. tonight, so that those of you who can't stay for the whole program in its entirety, you can come back and listen to it at your convenience. You may also send a link to someone who you believe can benefit from this program. So today, I will be talking about a very important topic. Today's topic is one that affects thousands of individuals and families, and yet it is often misunderstood. And we will be discussing what is called comorbidity in substance abuse, also known as co-occurring disorders or dual diagnosis. And this is especially important to people who are in the helping professions in the field of drug rehabilitation and so on, but also very important for family members to also understand. Now, many people believe that addiction is simply a matter of weak willpower or poor choices. Others think mental illness and drug addiction are separate conditions. Modern science tells us otherwise. Very often, these two conditions occur together, each making the other worse. Today, I will explain what comorbidity means, why mental illness and addiction frequently occur together, which mental disorders are most commonly associated with addiction, and how to recognize the warning signs, why treatment often fails if both conditions are not treated together, what families can do, where people in Trinidad and Tobago can seek help, and why recovery is possible. I hope today's program will increase understanding, reduce stigma, and encourage people to seek treatment early. Now, what is comorbidity? Comorbidity simply means that a person has two or more illnesses occurring at the same time. In addiction treatment, it usually refers to someone who has a substance use disorder and a mental health disorder simultaneously, that is, parallel. For example, a person may suffer from alcohol addiction and depression at the same time. They may suffer with cocaine addiction and anxiety disorder. Then there's cannabis addiction, that is marijuana, and psychosis. There's also opioid addiction and PTSD, that is post-traumatic stress disorder. And of course, alcoholism and bipolar disorder. These are just some of the co-occurring mental health and substance abuse disorders that can exist together. Now, neither illness should be ignored. And very often I see in my practice and in my work at rehabilitation centers where sometimes we focus only on the drug addiction and not paying sufficient attention to the mental health issues. Both require professional assessment and treatment. So why is comorbidity so common? Researchers have identified several explanations. One, self-medication. Let me explain that. Many individuals begin using alcohol or drugs to relieve emotional pain. Now, someone with anxiety may drink alcohol to relax. Someone suffering from depression may use cocaine to feel energized. Or someone with traumatic memories may use marijuana to numb painful emotions. Now, initially, these substances appear to help, but eventually they worsen the original condition. Another reason is that drugs can cause mental illness. Certain substances actually produce psychiatric symptoms. We know about alcohol, and when people go into withdrawal, they start hallucinating. It's called delirium tremens, where they can see and hear things that are not there. We also know about marijuana and psychosis and schizophrenia. So examples include, as I said, cannabis-induced psychosis. Then there's cocaine-induced paranoia. You would have probably heard about people talking about the green man. When they smoke cocaine and they go into withdrawal, they start seeing all kinds of things, the police coming for them. And then there's methamphetamine-induced hallucinations or alcohol-induced depression. When the alcohol is wearing off, some people start becoming very depressed and start crying and all of that. There's also drug-induced anxiety disorders, where people start developing paranoia, suspicious of everybody around them, and so on. So sometimes these symptoms disappear after the person stop using the drugs. But sometimes they remain permanently. There's also what is called shared risk factors. Both addiction and mental illness may develop because of genetics, because some people may have a history of mental illness in their family, and they that will be exacerbated when they use drugs, especially marijuana, for instance. Then it can also be caused by childhood trauma, abuse, neglect, violence, family dysfunction, chronic stress, poverty, and social isolation. Any one of these indicators can cause either mental illness or cause a person to start using drugs and becoming dependent on them to deal with it. Let me go over that list again. Childhood trauma can precipitate it. Abuse, physical, sexual, neglect, deprivations, violence as well, and then the family dysfunction. If time permit, I could enlarge on these. Then there's chronic stress. You're having a stressful situation that is not abated at all. Poverty and social isolation. Now, the same factors increase the likelihood of both conditions. Some common mental disorders associated with addiction. I mentioned before, there's depression. Depression is one of the commonest co-occurring illness. And it is not easy to pick up because people do feel happy and people do feel sad. And the average layperson cannot really diagnose clinical depression. You may just think, well, they're having a bad day, or maybe have some problem that they don't want to talk about. Because the symptoms include sadness, hopelessness, a lack of motivation, poor concentration, sleep problems, and even suicidal thoughts. So that depression can lead to any one of these things. Many depressed people attempt to medicate themselves with alcohol. So a person who might have been introduced to alcohol recreationally realized, hey, when I take this drink, I felt different. And now when they feeling sad or any one of these symptoms that I mentioned before, they remember, oh wait, if I it's almost interwoven in our cultural fabric. We see people sharing alcohol at wakes because it is understood behind the scenes that look, this can help you to deal with the sadness. Or they may even, well, of course, it is prevalent at parties and weddings and celebrations because it enhances the euphoria. And it has become part of the culture where if we look around now and pay attention for a minute, you'll see once Caribbean people, and I think people even in other parts of the world, but especially Caribbean people in Canada or in New York, wherever you meet them, if there's any little get together, alcohol is in the middle of the proceedings, you know, so that many depressed people they tend to use alcohol or other drugs to medicate themselves. Now, alcohol is a sedative, and so are some of the sleeping pills that are prescribed and the tranquilizers as well. They can also change your mood so that, you know, maybe in the other program, I could look at I'm seeing a whole slew of prescription pill addiction, people coming in with dual diagnosis and using a combination of alcohol and illicit drugs alongside prescription medication. And that is dangerous. I'll speak about that at some point. Unfortunately, alcohol is itself a depressant. So if you already feeling depressed, you take the alcohol, yes, it changes your mood, but eventually when it is wearing off, you are going to become more depressed than you were originally. And you know what would happen? You remember that the alcohol had helped you to change your mood. So you go back again, and that is what repeats the cycle. The same person who got up this morning got into trouble with the alcohol, however, is going back again to the bar or to the drink. So that the result is a worsening depression after you take the alcohol, if you're already depressed. Then there are anxiety disorders. People suffering from anxiety often use alcohol, marijuana, and tranquilizers. And let me say this, the body is not able to distinguish which one was prescribed by the doctor, whether the tranquilizer or the sedative was prescribed by the doctor, or you're getting it from the marijuana, the cocaine, or the alcohol. Sedative is sedative. Stimulant is stimulant. Cocaine is a stimulant. So is coffee and caffeine. So that a lot of people use the drugs now to reduce fear and tension. However, repeated use increases anxiety over time because you are not learning how to cope in a normal way with anxiety or depression. All human beings become anxious to a certain extent or depressed at times when they have had bad experiences. But because of their culture and their orientation, they learn how to deal with these things without having to resort to drug use. But a person who starts using drugs at an early age never learn these coping strategies. So they are more likely to become dependent and addicted in the long run. So what happens? Repeated use increases anxiety over time, and then the person needs more drugs to obtain the same temporary relief. Because in the meantime, the body develops tolerance. where the same 5 milligram of the tablet that used to deliver the result is not working anymore. And the body has a natural tendency to develop tolerance for any substance that is introduced to it. The body always seeks to neutralize it because it doesn't belong, you know. Then there's bipolar disorder, individual experiencing manic episodes, that is, they're extremely happy and often misuse alcohol or stimulants to kind of bring them down, to cope with it. So during depressive episodes, they may misuse sedatives. That is, bipolar means you could be happy at one time and you be in the dumps, real depressed at other times, you know, extremes of emotions. So during depressive episodes, they may also use sedatives and become more depressed. Without stabilizing the bipolar disorder, addiction treatment alone usually fails. And I'm seeing this in my practice a lot. I see people highly motivated by counseling and they have developed good insight and all of that. But because they had been put on some psychotropic drug, a sedative or a tranquilizer, and they then, when this developed tolerance to it, they started to supplement it with alcohol or some other drug. Now they're realizing that, they're getting into trouble with the drug addiction. The alcohol use is becoming excessive and can't go to work and getting into quarrels and all of that. So they target the alcohol. All right, I'll stop using the alcohol. But the sleeping pill is the same thing. It's just like alcohol in a solid form. So if you stop using the alcohol and then you go on sedatives, you are just substituting. And people in the helping professions need to understand that because you're just prolonging the agony. It is one of the reasons that when I worked at Cora Hospital, I introduced the use of acupuncture to treat drug addiction, to deal with all the withdrawal symptoms. Now, you cannot get addicted to acupuncture, and it successfully deals with the withdrawal symptoms. So it is, in fact, it's now being used in Europe, in North America, in South America, very widely because you can't get addicted. And it does much more than just deal with the withdrawal symptoms. It helps the person to bring the body into balance, help them with insomnia and even the original depression. Now, if you don't stabilize the mental health condition, the person it's just a question of time. They are going to return to the drug use because if they come off the alcohol, they may start using more and more of the synthetic drugs because the 5 or 10 milligrams. And I have seen people here who literally on handfuls of medication and still can't sleep, still very depressed and anxious. Then there's, of course, post-traumatic stress disorder. Many individuals who have experienced sexual abuse can suffer with PTSD. That is a short name for post-traumatic stress disorder, or physical abuse, victims of domestic violence, people who have had accidents can also suffer with PTSD. Those who might have been the victims of armed robbery. I have counseled many, many people. In fact, I personally had an experience with my vehicle being stolen, by armed robbers and so on. And I tell you, it's an experience that is very, very traumatic because you come very near to a point where you think you're going to die. So then there's people who live in communities, and I'm thinking of, the people in the East-West corridor, my brothers and sisters in Laventille and all of that. Communities where there's a high level of community violence, where you don't know when shots are going to ring out, and you have to duck for cover. And you have seen so many people who got they were in the wrong place at the wrong time. Just this week on the news, I was hearing about a young man in Laramie whose mother was bewailing the fact that look, her son just happened to be in the wrong place at the wrong time, and he was shot and killed. So people who experience these kinds of abuse and violence can develop post-traumatic stress disorder. Alcohol and drugs become an unhealthy way of escaping traumatic memories. And we know, we've seen from films, where soldiers in the midst of battle and Navy men and so on who on warships and all of that, it's part of the culture where you drink to stabilize your nerves and so on under fire, you know, so that outside of war and all of that, a lot of these returning veterans, they have serious problems with post-traumatic stress disorder because to be in the line of fire and to be shot at or to have to kill other people, these are not things that you can really just wipe out of your memory. Then there's other mental illnesses that can push people to use alcohol. And I've seen quite a number of patients when I was at St. Anne's Hospital in Wadi, even Cora, who was schizophrenic, but also had a substance abuse disorder. People with schizophrenia have higher rates of substance abuse than the general population because their judgment is compromised, you know, their decision making process is affected. So, drug use often worsens hallucinations and delusions that they already have because of their mental illness. The drugs just exacerbate it. Medication becomes less effective as well when you're using it in conjunction with other drugs, alcohol and marijuana and so on. And of course, relapses become more frequent. And I have seen so many people, it's really heartrending to see young people. I remember this one particular person whose father was a prominent doctor and who in college days suffered with depression and was put on sedatives and tranquilizers and started to develop tolerance. And then she started to supplement it with drinks, and living in that kind of society, upper middle class and so on. You get invited to parties and all of that where drinking is common. You have the bar in the house. And without realizing it, she crossed that invisible borderline from social usage to compulsive use. And now she was on both the prescription pills, which were not working. She had developed tolerance, had to take the alcohol together with it, but now was, you know, getting drunk in the wrong places and misbehaving under the influence and all of that. Decided to go to AA and seek treatment, but to no avail because she stopped the alcohol, but still had to deal with the depression and the anxiety and would go back to the medication, and the medication is not working. And if you don't take more, it will have no effect. And if you continue to take more, you're going to overdose. And I'll speak about that maybe in another program. So, which drugs are most frequently involved in these disorders? The substances most commonly associated with psychiatric disorders include alcohol, cannabis, cocaine, crack cocaine, methamphetamines, prescription sedatives, opioids, ecstasy, and synthetic cannabinoids. Even the vapes and all of that, the all the various oils that you get from cannabis, the CBD and all of that, a lot of people are using these in conjunction with their mental health disorders. Each affects the brain in a different way, so that each carries its own risks. Now, the people who develop sedatives, sleeping pills, for instance, they never tested it on people who were under the influence of alcohol. They measured its effects on people who were normally sober and who had a problem with insomnia. So that alcohol sedatives really help you to sleep. But when you start using alcohol in conjunction to supplement the sleeping pills, it is a very dangerous habit because you can end up putting your heart to sleep instead of your brain alone. And there are people who actually died from use overdosed and died because they combine illicit drugs or alcohol along with their medication. Now, some of the warning signs of co-occurring disorders. Families in particular need to seek professional help when they notice the following. These are all red flags. They are not in themselves conclusive evidence, but this is what families need to look out for. And if you see these signs, you need to take the person to have a professional evaluation. People who are displaying severe mood swings. Now, there's also something called a premorbid personality, where this was a normally quiet, nice, easygoing person, and all of a sudden you see them becoming, very, very angry or very depressed and severe mood swings, especially if there's incidents of hallucinations. That is a pretty serious sign when they're seeing and hearing things that are not there. Now, we have to be careful in this culture. There's a tendency to believe that we have Jambi and we have spirit possession and all of that. It's embedded in our culture, and so that when we see a person hallucinating, pretending to hear voices or getting God talking to them, and they're being inspired by deities and all of that, they very well could be in withdrawal from some drug and need to be evaluated. Then panic attacks is also one of those signs. Suicidal thoughts, because all of these can happen when a person is using either prescription drugs or alcohol and marijuana and all of those things. And when they stop, these are all prevalent in what we call withdrawal symptoms. When you stop using the drug and it is wearing away from your body, you can start having suicidal thoughts. It can result in violent behavior, especially I've seen this with marijuana users. When they're not using, when they didn't get the smoke this morning, boy, they're very irritable. You can't discuss anything with them, it ends in an argument. And then there's the paranoia, where you seem like, you don't not trusting anyone at all. Husband is not trusting wife. If you are using, either of you can be mistrusting now and blaming the other one and sharing things that are unrealistic. Then there's, of course, in extreme cases, social withdrawal, where the person now, they don't want to come out, they don't want to go outside, they don't want to mix, they find an excuse not to socialize at all. Or personal hygiene, a person who used to be spick and span, you know, now is unkempt, not shaving, not bathing, not cutting their nails, not wanting to go to the barber, have the same clothes on all the time, And in extreme cases, we see that with the skid row drunks and so on. For personal hygiene, then increasing drug use, where not only in the amount they use, but the frequency as well increases. Repeated relapses. Although you're going to the meeting, going for counseling, but you're still relapsing because what you have literally been doing is substituting. You stop using the alcohol or the cocaine, but you're still on the psychotropic drug, the sedatives and the tranquilizers, and the people in our doctors and psychiatrists they are aware of this, and of course, general practitioners in particular and people in the rehabilitation services need to be mindful of this, that we have to have an exit plan when we have people on psychotropic drugs. We shouldn't put them on it for the rest of their life, as is happening a lot of times. People tell me, the doctors say, you can't come off this, you have to take this for the rest of your life. And what would happen? In a little while, you develop tolerance and the tablet not working again. And what are you going to do then? That's a serious question. So these warning signs should never be ignored. Now, why is diagnosis difficult? And this is especially for people in the helping professions. Diagnosis and people who are lay persons and family members, very difficult is often, diagnosis is often complicated because drugs can imitate mental illness. A person under the influence of drugs can, the alcoholic in withdrawal, he can appear to be crazy. He's seen and hearing things that are not there. So too do the marijuana user, the cocaine user. For example, heavy cocaine use may resemble bipolar disorder, where when he take it, boy, he high like a kite. But when it's coming down, he's in the dumps. That's why he have to go and get it if he has to steal to get it and get himself into serious trouble with the law. Alcohol withdrawal may resemble anxiety disorder. So too with alcohol withdrawal, where you become very irritable, very restless, and all of that. Cannabis may resemble schizophrenia because when it's wearing off, you can start having, strange thoughts coming into the mind. Now, professional assessment is therefore essential in these cases. I mentioned it before, why treating only one addiction is not enough. Because imagine treating diabetes while ignoring high blood pressure, because these two almost seem to go together. Similarly, treating addiction without addressing depression or anxiety often leads to relapse. I should say treating diabetes rather, because you can be diabetic without high blood pressure, you can be hypertensive without diabetes, but it is like treating diabetes but not looking at your diet, your lifestyle, or treating high blood pressure and not wanting to adjust your lifestyle, still want to eat all your curries and your salt and your everything, and not want to exercise and all of that. So similarly, treating addiction without addressing depression or anxiety often leads to relapse. The individual returns home, the emotional pain remains, and the drugs again appear to provide relief. Because your environment has not changed, your coping skill has not been reviewed and improved, so that you go back into the same milieu, in the same situation, without knowing how to deal with it. And this is why recovery collapses. So that you must have what is called an integrated treatment approach. Modern addiction medicine recommends treating both illnesses together. There's the integrated treatment approach, and this will include medical assessment. Now, at Cora, I know we did, as you came in, you had a complete psychiatric evaluation and a medical, your blood works were done and everything, medical assessment. Then a psychiatric evaluation is critical. Then there must be detoxification when necessary. So that, for instance, at the Substance Abuse Treatment Center at Cora, if you presented with a mental illness, you would have to go to St. Anne's first, have that dealt with, and then you would be sent to Cora to deal with the substance abuse. And of course, counseling will be critical. Then CBT, which is cognitive behavioral therapy. Family therapy is important, so that family also understand how they are affected and what they need to know about treating with a person who has a dual diagnosis. Medication when appropriate, and I use that word very cautiously because you don't want to take a person of alcohol and put them on something else that is even more addictive and more disastrous. Peer support groups like NA and AA has proven itself to be very, very useful. And of course, introducing the person to a healthy lifestyle, to healthy lifestyle changes is also very, very important. This approach produces much better outcomes when they are combined. Now, the importance of medication. Yes, it is important. Some individuals genuinely require medication, especially in the initial stage when they have difficulty to sleep, or if they are hallucinating, or they are suffering with psychosis and all of that. And examples include antidepressants, mood stabilizers, and antipsychotic medication. These are sometimes essential, necessary. These medications should never be stopped without medical supervision. Now, medication is not a substitute for counseling. You can't just use drugs to treat drug addiction. So, in the initial stages, you use the medication. And in my case, we don't use medication, we use acupuncture, which has been found to be a very useful alternative. And I had a lot of doctors, prominent psychiatrists, who would refer the patients to me for acupuncture. So that counseling is not a substitute for medication when medication is required. Both may be essential at the certain time. Now, the role of families. Families often ask, you know, should we show tough love? A lot of people don't understand what is this tough love. The answer is yes, it must be balanced. You know, families should encourage treatment and avoid enabling. That is, making excuses for the person, trying to pay back the pusher, trying to prevent them from having to suffer the consequences of the addiction, you know. So it's a mix where I in the old days, they would talk about confronting the alcoholic or drug addict. I rather use a word called carefronting. You confront them, but you let them know you're doing it because you care about them. It must be done with a genuine intention. Then families should also support medication compliance, especially where there's evidence of mental illness. If there is mental illness, they have to comply with the medication. Otherwise, a person who is mentally ill is not really mentally available to benefit from counseling and psychotherapy. This is why the mental illness has to be managed properly if the person is going to benefit the from the counseling and the psychotherapy. Then family members need to also attend family counseling so that they can understand what their role is in this arrangement. They need to avoid blaming the person. I know people like to, after a while, you get fed up and call them all kinds of names and so on. The best way to avoid all of that and family members to become useful is to listen to programs like this. Educate yourself about what you're dealing with. When you know what you're dealing with, you're in a better position to deal with it. And of course, encourage recovery activities. The person remind them, look, you need to go to your meeting. You shouldn't be going and liming with them fellas who are going to make a river lime and they're going to have alcohol. Stay away from sticky, slippery people and places. So recovery improves when families become informed partners, rather than blaming the person and scapegoating them. You understand them and you work with them without enabling them. Now, relapse does not mean failure. Relapse for people who have dual diagnosis is very common in both addiction and in mental illness. Because a lot of people, they if they're not mentally fit, they don't even remember to take the medicine. The family members have to remind them or make sure that they get it, or they go for the injection, when they're supposed to, and all of that. So Relapse sometimes signals the need to review treatment rather than abandon hope. When a person relapses, what I do with my patients is that we sit and we do what I call a post-mortem of the relapse. Where were you when it happened? What was going through your mind? What happened before that? You know, and we go through all the details, identifying what might have triggered it, so that in future you could avoid that. You could learn from that and be able to prevent it from happening. So that each relapse teaches valuable lessons. Recovery always remains possible, even no matter how many times a person has relapsed. I've seen people in recovery now in Alcoholics Anonymous who relapse several times. I mean, even in my practice here, people have relapsed, but eventually they have been able to make it. You know, the truth is, it doesn't matter how many years you're sober. The drink or the drug is just an arm's length away. And if you are not doing things to maintain your recovery, that is, living by the 12-step program, for instance, you know, maintaining a healthy lifestyle, it is always possible that a person can relapse. Now, reducing stigma is very, very important because this is one of the greatest barriers to treatment. Stigma. In this society, you know, alcoholics are highly stigmatized, but drug addicts, pipers, we call them on all kinds of names, they are even more stigmatized. So that people, they always fear of being labeled, even when a person might go, our natural way of dealing with a person start hallucinating or talking out of their head, as we call it, we take them to the general practitioner and he picks up that there are signs of psychiatric symptoms there. And well, I have been made to understand ethically that psychotropic drugs should really be the the domain of psychiatrists who are already trained and to prescribe those drugs. But I am aware in Trinidad and Tobago, even general practitioners are prescribing psychotropic drugs. This is something that needs to be looked at, because it can cause sometimes more harm than good. So that family members are afraid to take a person who is presenting with mental health problems. Initially, they are afraid to take them to the psychiatrist or to an institution because to be labeled as mad or mentally ill in this society, if that ever goes on your file, some diagnosis, mental illness diagnosis, it can become like a death sentence, follow you for the rest of your life, especially in small communities. He went St. Anne's, they would say, he's a madman. And, this social pressure can become very debilitating to a person in terms of getting a job, socializing, being considered an equal partner in the community. So that words like mad and crazy or weak, these are all labels that prevent people from seeking help. Even family members can try to see if they could fix it in house because they don't want anybody to know. And the problem becomes worse. So that mental illness is not a character flaw. Anyone can become mentally ill. You could be born genetically predisposed. And addiction is not a moral failure because a lot of people who started off and became addicted did not intend to become addicted. They started socializing, enjoying themselves just like everybody else. So that, but I want you to remember that both are treatable health conditions. Yes, but they have to be dealt with. You can't treat with one and not treat the other. So that recovery is possible. Thousands of people around the world recover every year. They return to work, they rebuild their families, they regain health, and they rediscover hope. But recovery requires commitment. Commitment from the person who is ill and to some extent the family members as well. Because when family members do not understand this, you know, I because of the stigma, I remember myself being told, look, you're not an alcoholic. You just drink a little bit too much sometimes. But that was not true. I have crossed from social drinking into compulsive use. But my family and the people close to me did not want to admit that because that would be a stigma on them as well. So that recovery requires support. It requires patience. It, it didn't take, it didn't happen overnight, and it will not go away overnight. In fact, recovery is something that needs to be attended to for the rest of your life. Most importantly, recovery requires believing that change is possible. Because sometimes family members, they reach to that point where they say, look, I don't think he will ever change. And the alcoholic or the drug addict themselves, they accept it. That, look, you know what? I will have to die like this. I can't. In fact, I don't want to change because the change is very painful. So quickly, before I know time is running out on us, before I leave, I want to look at some of the resources in Trinidad and Tobago. If you or someone you know is struggling with substance abuse, who also has evidence of depression, anxiety, trauma, or another mental health condition, seek professional help because there are useful resources of assistance in Trinidad and Tobago. You have, of course, the Ministry of Health's mental health services. In every sector of the country, every county, there are health centers. And in most of these, you have mental health officers, psychiatric social workers who attend, doctors, and they provide mental health services there. Then there's the regional health authorities that provide psychiatric clinics. There's the Substance Abuse Prevention and Treatment Program at Cora Hospital. I worked there for many years. And then there are drug rehabilitation centers, like in San Fernando, you have the Ward 1. You have private drug rehab centers, non-governmental organizations like New Life Ministries, Heal House, Rebirth House, Serenity Place. All of these are drug rehab centers that provide services. Then, of course, there's Alcoholics Anonymous. We have the highest proliferation of AA groups per capita than any other country in the world. In my community, there's 5 AA groups. At least almost every night you can get an AA meeting in this Presbyterian school or the Hindu school. Then there's Narcotics Anonymous. We also have quite a number of qualified psychiatrists, psychologists, counselors, and social workers. And early intervention greatly improves the chances of successful recovery. Now, as I conclude today's program, I want to leave you with this important message. When addiction and mental illness occur together, they should never be treated as separate problems. I'll say that again. When addiction and mental illness occur together, they should never be treated as separate problems. Treat the addiction, treat the mental illness, support the family, and protect hope. That is what will give them hope and a chance of recovery. So, if you are struggling today, please remember that asking for help is not a sign of weakness. It is one of the strongest decisions you can make. Every day, people recover from addiction. Every day, people learn to manage depression, anxiety, bipolar disorder, and other mental illness. Every day, families are reunited. Recovery is real, recovery is possible. It's never too late. Nobody ain't gone so bad that they can't recover. Recovery begins with one decision, and that is to ask for help. So I want to thank you for joining me for today's program. I look forward to being with you again next week, Thursday, as we continue exploring topics that promote healthier individuals, stronger families, and a healthier Trinidad and Tobago. So until next time, take good care of yourself and remember there is always hope and help is available. Thank you again. Thank you to Radio and TV Jagriti. And remember, this program will be posted on YouTube and Facebook in a few minutes. And it will also be repeated on Radio and TV Jagriti at 9 p.m. tonight. I want to thank the staff at Radio and TV Jagriti, especially the CEO, Mr. Vijay Maharaj, for giving of the station's services free airtime for this program every week as a public service. So thank you all again and see you all next week. Bye for now.